At St. Mary's Medical Center in Chicago, everyone had quietly given up on one patient. He was the old man in room 412, the case with no hope. Nurses walked in gently, adjusted his checked his vitals and walked out a little heavier each time. Residents skimmed through his chart, whispering medical terms and probabilities. The specialists came with serious faces and left with silent shrugs. His name was Thomas Reed. To the hospital system, he was a 68-year-old with heart failure, diabetes, pneumonia, and kidneys that had nearly shut down. To most people, he was a number on a monitor. To his family, sitting beside him every day, he was Dad, Grandpa, the man who used to flip burgers in the backyard on Sundays, who never missed a school play, who cheered at every little league game like it was the World Series. Machines breathed for him now. The steady beeping of the heart monitor was the only sign that there was still a fight going on inside his frail body. His daughter Emily held his hand and whispered, "I'm here, Daddy. Even if you can't hear me." His teenage grandson sat in the corner, pretending to scroll his phone so no one would see him wiping his eyes. The family had started to talk about when, not if. Then Dr. Ethan Carter walked in. He was the new attending physician, mid-30s, a little tired in the eyes, but with a kind of stubborn gentleness that you don't see often. Some doctors called him too soft. Some thought he cared too much. Ethan just thought, if this were my father, I'd want someone to care this much. On his first day taking over the case, Ethan didn't look at the machines first. He walked straight to the bed, looked at Thomas for a long moment and said quietly, "Mr. Reed, I'm Dr. Carter. Everyone says there's nothing more to do, but I'm not ready to believe that yet." There was no response. No sudden movement. Just the usual beeping and the mechanical rise and fall of his chest. But as Ethan leaned in to adjust the blanket, he saw it. A tiny tear sliding down from the corner of Thomas's closed eye. So small you could have missed it by blinking. The nurse didn't see it. Even the family didn't. But Ethan did. And that one tear felt like a silent shout. "I'm still here. Don't walk away yet." Later, in the conference room, the senior doctor flipped through Thomas's huge file and sighed. "Ethan, this man has been here for weeks. His organs are failing. We've thrown every textbook treatment at him. There's a time to fight and a time to accept." Another doctor added, "We should focus resources on patients who actually have a chance. This is America's healthcare reality. We can't save everyone." Ethan understood the logic. He understood the numbers. But he couldn't shake that tear. "I get it," he said quietly, "but something doesn't sit right with me. I feel like we're missing something." That night, when most of the